All right. I want to welcome everyone to the Miami-Dade Chamber of Commerce partnership with Jackson Health Systems on how to reopen your business and basically tips for reopening your business during COVID-19. We're going to give a few more moments and let everybody get on and get everything moving, and then we're going to start this panel. So thank you very much, and bear with us as we get everyone in. Probably get some intro music during this waiting time. Probably get some intro music during this waiting time. All right, so for those at this moment, you can go on Facebook and you can share this and create a watch party. So feel free to share this with other people so that they can join us for this conversation. You will see in the link that they can actually, from Facebook Live, you can join us by clicking the link in the title and join us through Zoom so that you can ask questions to our participants, our panelists today, and also comment, and we can keep you live. So please join in now, share, create watch parties. We're going to get started in 2 minutes with our presentation. So share, 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 join. This is something that we need to ensure that we are able to keep up with. As everyone knows, Miami-Dade County is opening up the businesses. So we want to make sure that our business owners are part of the conversation. So please share, please create watch parties so that we can get this information out to as many businesses as possible. We have an excellent panel, and we're going to start in 2 minutes with the panel. So as everyone gets on and starting, please share, 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 and create a watch party and join us through the conversation. All right, I see a few people have joined us on Facebook. It's good to see you. Ms. Kanasha Paul from MBDA. We have our President Eric Knowles for the Chamber. Ms. Boone from the Black Affairs Society. All right, Commissioner Joseph Kelly from the great city of Opelika. We have Glendon Hall. That's good. All right, all right. Make sure everyone share and join the conversation. It's important. We're going to have some amazing panelists, as you can see on the screen today. and we are going to start. It is 10:05. So I want to welcome everyone to the Miami-Dade Chamber of Commerce and Jackson Health System Technical Assistance Workshop on keeping your workplace safe and tips for reopening during COVID-19. This is part of a series that we do on an annual basis with the Miami-Dade Chamber of Commerce and Jackson Health through our partners, where we bring together experts in the field to talk about government contracting, procurement, contracts for your businesses, and just tips on how to lead a successful business during this time. Due to COVID-19 and the pandemic that's been going on, we wanted to make sure that we leveraged our partnership we have with Jackson Health as the public health arm of Miami-Dade County to give some tips for our businesses that are reopening during this time. So I want to thank you for joining us in this conversation with the Miami-Dade Chamber of Commerce, and I wanted to pass this on to our Amber Lawhorn, who is Director of Small Businesses at Jackson Health, and she will lead us panel in an amazing discussion that we're going to have today. So thank you very much, Ms. Lawhorn, for helping to organize this and bring Jackson Health to provide our businesses with this opportunity. So you have the floor, Ms. Lawhorn.
Thank you, Matt. Thank you very much. It's a pleasure to be here this morning. This is our first Zoom outreach event, so thank you to the Chamber for this opportunity to partner in bringing this information to the community. These are unprecedented times, and we all have to figure out what's going on from one day to the next. And we've been eagerly awaiting for businesses to get the opportunity to get back operational, to bring their teams back, to begin earning income for themselves and their families. We just heard in the past day or so that the county, Miami-Dade County, is preparing to open up a number of businesses beginning next week. So this information is extremely timely, and we hope that it truly brings value to the people that are listening in ways that we can keep ourselves, our workplaces safe, because if our workplaces are not safe, then our homes are not safe. We go to work, we spend a lot of time at work, and then we go home to our families. So it's very important that the workplace is safe in order to keep our household safe as well. With that, we're going to get right into the panel. Very honored today to be on this panel, to be moderating this panel with some amazing people from the community. We first have Kathleen Sposato. She is the Senior Director of Infection Prevention and Control here at Jackson. Thank you, Kathleen, for your participation, for being available to bring expert information to the community. I'd like you to take an opportunity to tell everyone a little bit about yourself.
Okay, sure. And I'm very grateful for the opportunity to be part of this group and to address some concerns related to reopening businesses. So as you said, I'm the Senior Director of Infection Prevention for Jackson Health System. I've been here for almost 5 years now. I am an infection preventionist and have been involved in that discipline for about the past 20 years. This is truly the most intense infection-related issue that I've ever had to deal with. I'm grateful to be at Jackson while that's happening.
Experience of a lifetime for sure.
Yes.
Mm-hmm. Okay, and next we have Sharice Chester. She is the Chief Creative Officer of Creative Vision Media and my partner in success for small businesses. Sharice, can you tell everyone a little bit about yourself?
Thank you, Amber. Once again, I'm Sharice Chester, owner of Creative Vision Media, established in 2002. We, of course, offer media relations services, but our role in this effort is our advocacy for small businesses. And I look forward to sharing some insight in terms of what we're doing as a small business to make sure our employees are safe.
And finally on the panel, we have Derek Williams. He is the proposal coordinator for Able Business Services. He is participating very graciously in place of William Berry, who is the CEO and president of Able Business Services. Derek, do you want to tell us about yourself and Able Business?
Yes, good morning. Thank you for having us. We're a local minority-owned business. We've been in business approximately 19 calendar years. We're a commercial janitorial services company. We provide services for Miami-Dade County Transit, Miami-Dade County in and of itself, the city of Miami, the state of Florida. We have quite a few municipal contracts, and presently we're providing services specifically dealing with COVID-19, sanitization services for facilities, as well as fleet vehicles, buses, transit facilities.
Thank you, Mr. Williams. And finally, we have who's going to say a few words, Mr. Eric Knowles with the Miami-Dade Chamber.
Good morning, everyone. Thank you for being or joining us this morning. Amber, thank you for all that you continue to do. And we're excited to know that this is your first Zoom. So we look forward to engaging with your staff and your team and learning more. As you said, we have to prepare, as the mayor has announced that businesses will start to open next week. So what does that mean? We actually have a document that we're going to share with the members of the chamber that the county has put out in that preparation. So I will be getting that to you all very shortly.
Thank you very much. Okay, with that, we're going to get right into the panel discussion. I'm going to start with Kathleen. Jackson is committed to bringing those attendees that are on today factual information that can help you safely reopen your workplaces. So Kathleen, can you tell us some of the key ways that business owners can keep their workplace safe?
That's my intent. And I think that we need to be very cautious about using the word safe. I think what we're going to be doing now is reducing risk, but until we have established immunity within the majority of the community, we cannot count on things being safe. It looks like this first wave of the pandemic is diminishing a little, fewer hospitalizations, patients are getting better, we're seeing fewer emergency department visits related to COVID-19. But it is very likely, and I think that most medical experts across the country, including Dr. Anthony Fauci, they believe that there will be a second wave, perhaps late summer, early fall, and we will probably continue to see some baseline COVID-19 activity going forward, and then intermittent waves. If this pandemic follows the pattern of the influenza pandemic of 1918, the wave in the fall will be more serious, and we really need to have made the behaviors that reduce risk part of our everyday. Mr. Williams, I'm glad to see you've got a mask on. Mine is right here. I don't go anywhere without it anymore. I appreciate that. And looking at risk reduction, there are really three major strategies, different kinds of buckets of interventions. The first is work practice controls. Okay. The second is engineering controls, and the third is administrative controls. And I know we have people from ABLE services here, so I'm sure that they'll talk about environmental cleaning and disinfection. I think it's very important to understand how the virus is transmitted. And I'm not sure that everybody gets that. It is a respiratory virus. It comes out in large droplets from your nose and your mouth. So it's not necessarily going to remain airborne for any long period of time. It's more likely to come from somebody's nose, mouth while they're talking, while they're yelling, while they're singing, coughing, sneezing, obviously. And those droplets can either land on the mucous membranes of their next victims, nose, mouth, or eyes. And that's how the virus gains entry into our bodies. It is not absorbed through our skin. It doesn't come through our clothes and infect our bodies or anything. It has to get onto the mucous membranes of our face. And some people refer to that as the T-zone, eyes, nose, mouth. A second method of transmission, which is not as likely, but it is hypothetically possible, is that the droplets come out of my nose, my mouth. Let's say that I'm infected with COVID-19. They land on a surface and someone else comes around and they're gonna use my computer. They touch the surface where my droplets have landed, and then they touch their eye or they rub their nose or whatever. And That's how there can be kind of secondary transmission, rather actually indirect transmission. So with that understanding, we can really come up with some good strategies for prevention of transmission between individuals. And I'm going to talk about work practice controls first. Those are the things that individuals do. And I'm hoping that people are not just doing this at work. This is really behavior practice controls. Number one is hand hygiene. Keep your hands clean. Assume, no matter what the Able company is doing, that every surface you touch is contaminated. And no matter how clean it looks, these droplets are invisible. Assume that it's contaminated. Don't touch your eyes, your nose, your mouth until you've cleaned your hands after you've touched some object. And I want to make the point that gloves are not really protective. I think that they sometimes give people the false sense of security that they're protecting themselves, but gloves become just as contaminated as your hands do. They can also transmit droplets as easily as your hands can, either to another surface or once again to your eyes, your nose, or your mouth. I think probably the best strategy, and I'm surprised it took this country so long to begin implementation of this strategy, is wearing a mask, just a regular mask. It can be cloth, it can be the mask that Mr. Williams is wearing, anything. It should not be an N95 respirator mask unless you are working in healthcare and you actually need to use that. They're in short supply, and it's not really responsible for people who don't need a respirator to wear one when healthcare workers are struggling to get them. The mask is protective of the person who's wearing the mask, so the wearer is protected from droplets that may be coming from an infected individual, but it also protects everyone else who is around the person who's wearing the mask. And that's the message of the mask. It says to everybody that you're coming in contact with, I respect you, I am concerned about you, and if I'm asymptomatically infected, I don't want to spread my infection to you. So it shouldn't be perceived as a sign of weakness or I'm afraid of this virus or anything like that. It is, I understand what my part in prevention is, and I'm going to do my part. I'm going to be a responsible human being here, a responsible citizen.
Good points.
And it's important to remember that people can be asymptomatically infected, never develop symptoms, but capable of spreading the disease. There's also an incubation period, on average 5 days, where they can spread the disease, but they have not yet developed symptoms. So there are times when people are walking around and they don't know that they have the infection, and that's where the real risk is, which is why we don't just wear masks when we have a cough or a fever or anything like that. It's constantly.
So Kathleen, with that being said, may I ask you, we're expecting employees to return back to their workplaces. If someone is asymptomatic, what are some of the things that you can ask them? And how can you go about asking them in terms of what kind of risk they actually pose to the workplace?
That's the conundrum of being asymptomatic. There's nothing you can ask. You could possibly ask, have they been exposed to somebody who has a confirmed diagnosis of COVID? That would be, then they have been potentially infected, but there's no real way to know without doing some testing, which is why the mask use has to be universal. If you come in contact with a patient who's got COVID-19, you're wearing a mask and they're wearing a mask, there's no exposure happening. There's no transfer of droplets to the mucous membranes of your face. Some other work practice guidelines are staggering start and break times, reducing volume. So when people say that they're going to have, they're opening up 25%, they're taking out 3/4 of the tables in the restaurant. That's reducing volume. So trying to minimize crowding.
So Kathleen, when you're saying staggering start and break time, so that means maybe you want to have some people in the office at one time, others in the office at another time. You want to kind of separate the staff a little bit.
So they're not all coming in the front door at 7:30 in the morning. So some people come in 7, some 8, some 9. That also helps with transit. If you can drive a car, that's going to be less risky than taking mass transit, getting on the train or taking a bus. I'll talk about administrative controls in a minute, but one administrative control is reducing parking fees for people who have cars. That gets them off the train. Continue distance work when that's possible. If you can work from home, that's where you should be working from.
Okay.
Obviously, respiratory etiquette. If you cough, you sneeze, do it in your elbow, not your hands. Curbside service and pickup, so people don't have to come into a business place and congregate. And screening customers and workers. So asking them if they're febrile, if they have a fever, any cough, shortness of breath, those kind of symptoms would be an indication that maybe this person needs to go get tested, and they definitely need to be wearing a mask. And they should not be at work if they're symptomatic. I wanted to talk a little bit about engineering controls, and I think that the work practice controls are the least reliable because they are human dependent. It takes somebody actually putting on a mask, keeping the mask on in order for that work practice control to work. They have to clean their hands in order to make hand hygiene work. So that's really a personal decision every day, every minute of the day. Engineering controls are a little more reliable. So you're setting up the environment to support what you're trying to do. Physical barriers, either plexiglass, where people have to interact with customers. And they're in stores now, Publix and Walgreens, and everyone has put up those plexiglass barriers so that there is a separation between the customer and the healthcare worker. Arranging the workspace so people are not right on top of each other, moving apart, putting up physical barriers between workstations. Arranging the workspace so that there's one-way traffic. People come in one door, they leave through another door, so that people aren't going back and forth, coming into contact with each other. You can increase the space between people, decrease congregation of individuals. So once again, staggering lunches, staggering breaks, removing chairs so that people can't sit next to each other, putting distance markers like there is, once again, every time you go to a checkout, there's those blue tapes or little circles or whatever that tell you where you need to stand in order to keep a safe distance from somebody. And one more thing is making sure that the ventilation in an enclosed space is adequate and the filters have been changed. If windows can be opened, the outside air is going to be less risky than air in an enclosed space. Finally, administrative control. Policies or protocols or standards that a workplace puts in place in order to support the health and well-being of their employees as well as their customers. So absence policies, you don't want people coming to work when they're sick, so it's not a good idea to penalize them for staying home if they are sick, whether it's sick time or so many absences results in a being written up or some kind of disciplinary action. This is not the time when you want to have sick people working in your organization. Education for employees. They need to understand, number one, the mode of transmission of this virus, because they're smart and they'll be able to help out and prevent transmission. Ensuring that you have reduced risk for vulnerable populations. So elderly people, and unfortunately that's described now as greater than 60 or 65. So I'm an elderly person myself. People with comorbidities, people who are immunocompromised, people who are obese, they're at increased risk of adverse outcomes from this virus. Not at increased risk for getting it, but if they do get it, they're more likely to have a bad outcome, hospitalization, mechanical ventilation, even death. Influenza immunization is going to be very important at the end of the summer and the beginning of the fall. I don't know what kind of a flu season we're expecting. COVID-19 has really taken over, so we haven't been paying attention to what's been happening in Australia. But ensuring that employees have the opportunity to get a flu vaccine, if they have a private insurance company, asking them, flu clinics actually come and administer the vaccine to employees while they're working. And understanding that testing is available. So there are a multitude of Department of Health testing sites if people are symptomatic or, well, especially if they're symptomatic or if they've been exposed to somebody with COVID-19, testing is definitely indicated to understand what their situation is. Any questions?
Well, I had several questions, but you blew through them in your presentation. I think you started off on a very important note, and I'm grateful that you actually brought that to our attention. Safe is not the word right now. There's no treatment, there's no vaccine. So right now we are just minimizing the risk as much as we possibly can. And that's really important because it keeps at the front of our mind that we have to remain vigilant in order to protect ourselves from this virus. Sharice?
Sorry, I do have a question. So as a small business, I'm not as sophisticated as able to, understand what works. If I cannot find the Lysol, how do I disinfect my workplace? How do I make sure it's properly maintained every day? What can I look for? What can I use? Because I'm planning to return my team back to the office on June 1st. We've been working remotely. We've been fortunate enough that all of our clients are allowing us to conduct online meetings. But what should I use if I cannot find the Lysol, etc.?
This virus is very easy to kill. Any disinfectant is going to kill it. You can also make a dilute bleach solution. I think it's like 4 teaspoons of bleach to a quart of water will make a dilute bleach solution. It has to be made every day. It's not stable and light, so it's only really good for 24 hours. But this virus is easy to kill. So if you're making the effort to clean your workstation, it will be effective. Focus especially on high touch areas, computer mice, the keyboard, doorknobs, light switches, things that we don't typically think about cleaning when we're working in our workspace.
And Kathleen, I think you mentioned it before, but what is the frequency? Like Sharice was mentioning, if you're trying to clean your workspace for your staff, how often should that occur?
In the hospital situation, the hospital setting, our schedule is twice a day during the day shift and then once at night. So if you're working during the day, I'd say at the beginning and then halfway through your shift.
Okay, thank you very much. Okay, Kathleen, you referred a lot to the engineering aspect. So there's the physical requirements, there's administrative, and then there's actual engineering, the actual disinfecting and structuring the facility so that it's a safe, a less risk environment. So Derek, if you could tell us some of the ways that Able Businesses has been working to keep your own employees safe in the workplace. You're wearing your mask right now.
Yeah, it's company policy. Our company president, Mr. William Berry, is very active and involved in the community. Just to give you a brief overview of who we work for and what we stand for. We have been fortunate in an unfortunate situation to be able to hire an additional 100 some odd employees from the Miami-Dade County area to help assist us in trying to protect and keep communities safe. As a result of that and these new hires of the employees, we've trained them in the proper practices that are, and the proper practices which are required in order to eradicate COVID-19 viruses, so on and so forth. What we've done, we have a training program whereby we actually sit down with our employees and we take them through our steps in regards to the proper application of putting on gloves and taking off gloves, the appropriate use of PPE protection in regards to the wearing of the masks and taking off the masks, the frequencies in regards to cleaning and sanitization of facilities, whereby we may do it every 2 hours. These are just a few of the things that we put in place with our employees from the onset.
And how have your employees responded to that? Because we are often hearing, excuse me, about essential workers who have not really had a choice in terms of showing up to work or not during this entire pandemic. How do your employees respond to the efforts that you're putting in place to minimize risk in their environments?
Well, to be honest, our employees have been tremendous. Our attendance rate is probably borderline 97% attendance. And this is in spite of some of our employees needing to utilize public transportation. So, they've been great and we have really been appreciative of their services, to our company, to say the least. We also have implemented And we're implementing this moving forward with our newer contracts as we bring them online in the upcoming weeks. We're utilizing the infrared no-touch thermometer to make sure that our employees are not feeling, borderline or things of that nature going into these buildings, because we do contractually clean a great deal of public facilities. For the most part, the employees have just been tremendous. I mean, they've made themselves available to us in, numerous ways. In fact, some of our contracts, we have 12-hour shifts, and the employees have been, on the front line and just, willing to help out in all ways possible. So I really can express our gratitude to them.
That's amazing. And I think that it really speaks to they must feel that ABLE is doing everything that it can to keep them at a less risk than other situations. So congratulations to you all for what you're doing with your employees, and for going back to the community at a time like this to make sure that as many people can be employed as possible.
By the way, just to make mention, we also provide cleaning products and EPA-approved chemicals specifically for COVID-19.
Tell us about it.
Yes, we carry a large array of 3M quad cleaner, Husky quad cleaner, professional Lysol antibacterial, KN95 masks, standard surgical mask, everything's FDA approved. And we use all of these approved chemicals for our contractual obligations with our clients also, as required. We do have these items available for other businesses as well as, the public.
So Derek, thank you for saying that. I was about to ask, because a situation I came across last week was where I had to connect one of our small businesses with another minority supplier so that they could procure what they needed to keep their staff at a less risk in the performance of their daily operations. So how do people get in contact with ABLE Business in order to buy that? So I'm assuming that you're selling it in a retail fashion, right?
Absolutely. We do have a retail store. We're located at 1234 Northwest 79th Street in Miami,
Wait a minute.
Florida.
Slow down. Say that again.
We're located in Miami, Florida, and the address is 1234. Easy to remember.
Yes.
Northwest 79th Street, and that'll be Miami, Florida again, and the zip would be 33147. You can find us also online at ablebusinessservices.com, as well as on Facebook and the other vast amount of social media addresses which might go with that.
Okay, very good. That's really good information. Thank you.
I would also like to mention to the participants and the other individuals who may be on board that as a practice, we provide a disinfecting and sanitization service, which consists of electrostatic. And if I may explain what that is, when you're disinfecting a facility and you're utilizing electrostatic mechanisms, what it does, it allows the EPA-approved chemicals to actually stick to surfaces where the normal eye would not pay attention to, or the normal actual janitorial technician, in fact, would not pay attention to. So what the electrostatic does, it makes sure that every area is actually getting the appropriate application of the appropriate chemical to, possibly or potentially make sure that COVID doesn't arise. And what we recommend is that facilities, buildings, so on and so forth, have a deep disinfecting sanitization done prior to bringing the employees back on board or opening to the public. And from that standpoint, to try to apply some type of everyday routine maintenance of that facility from there. And I think from a liability standpoint, specifically in regards to businesses, out of an abundance of caution, I would definitely recommend that you have, a certified company, i.e. through the Department of Health or Miami-Dade County, to provide that service so you can rest assured that your facility, will be fine upon reopening and bringing back your employees.
And Derek, with that, let me jump to Kathleen really quick. Kathleen, what are we doing in terms of what some of Mr. Williams talked about, the electrostatic?
That's a new term to me.
Me too.
I know that in the hospital we're using sporicidal disinfectants, and that's overkill, but that's what we're doing with all of our COVID-19 occupied surfaces. We also have a technology, ultraviolet disinfection. We have the 3-tower system that we can put in a room that was previously occupied by a patient with COVID-19. And after terminal cleaning and disinfection has been performed, then we do an additional cycle with the ultraviolet disinfection, and that is effective also against coronavirus.
And do you feel, like Derek said, that people really need to consider a deep cleaning as they prepare to bring their staffs back to work?
Sure.
Okay, all right. Matt?
Amber, I wanted to jump in real quick because as this first started, I was able to, when cleaning supplies was basically gone in the stores, I was able to go to Able Business Services and get the cleaning supplies that I needed for my household and my family. And one of the most important things that I used quite a bit was the alcohol. They have the 99% alcohol that I was able to dilute so that I can spray groceries and spray things as they come in to kind of disinfect stuff moving forward. And then also a big bottle of Lysol. So shout out to Able Business Services for always having cleaning supplies on hand that we can use to disinfect our personal households and also our businesses. So I just wanted to put that plug in there really quickly for Able Business Services because they've been a pillar and they're pretty strong. So thank you.
Well, we got a customer testimonial. Okay, thank you very much. We're going to move on to Sharice because we want to make sure that we have time left for audience questions. So many of you are familiar with Sharice. She's, like I said, my partner in success in working with small businesses on Jackson's $2 billion capital program. Sharice has been working from home, she and her team, as she mentioned earlier. But one of the important things that we wanted to bring to the vendor community, Sharice works with other clients. I know you think Jackson is her only, but she also works with other clients, including the Department of Transportation. And some of her other clients require that their vendors have a safety plan in place. And I think it's important that it be a requirement for businesses as just a part of operations to have a safety plan so that you have a strategy to react in situations where you need to take precautions or take action to minimize risk in the workplace. So Sharice, if you would, where do you start in creating a safety plan?
So first I started with the schedule. We moved, as I said earlier, to remote operations. And as we prepared to re-enter the office workplace, we had to assign a safety officer, someone who's responsible for making sure that the steps that are required to reduce the risk, as appropriately required, are implemented. We established daily protocols. We are going to check in daily to make sure everyone's on the same page in terms of the mayor's notification. Right now we're in the yellow zone. Have we changed to another zone? Making sure we're always aware. Making sure there's protocols in place for vendors, visitors, and how we handle our mail. Making sure that we communicate with everyone in terms of, have you been exposed to COVID? These are the steps we take, and making sure the privacy issues are in place in our workplace. So we put together a plan as we return to the office on June 1st. We've been very fortunate that, like you said, the Department of Transportation, Department of Public Works, the school board, et cetera, we are able to conduct our meetings virtually. We've been very fortunate in that regard. But even when they are entering the building, as we work remotely, I told them to enter after hours, use a glove on the elevator, use a glove to enter the office, make sure you're disposing of it properly, making sure you lessen your opportunity for contact or interaction with people as you go to the office on your own schedule and own time. So I think when we return, we probably will be doing the staggered schedules to make sure that we're comfortable and we have an opportunity to correct anything that's not working to make sure that we are safe. I am absolutely pleased that it has the solutions. A big win, because that is worrisome. for a small business owner in terms of what can you provide to the members to make sure that the safety plan is in practice. Reduced risk is in practice. Without the proper materials, we cannot operate in the office. So I'm glad to hear that as well.
I think one of the very important things that you mentioned, because my next question was going to be, what are the elements of a good risk reduction plan? Risk reduction is the focus here, but I want to make sure to point out, you said something very important as an element, is to have someone that's responsible to make sure that this plan is actually implemented and carried out on a daily basis. So just tell us more about some of the other elements in your plan.
So I think the construction model in that regard is the best one, because we know on construction sites, you do an early morning check-in, a safety huddle. So that's going to be required. And some of the other elements are making sure the layout of the room is proper spacing. Break room for our office, we'll have signage, one person at a time, because it's rather small. Making sure that we're not using the water system, but everybody's bringing their own bottled water. Everyone's bringing in their own coffee. You're not using the system that's currently available. And also making sure that we are separated properly. We're not congregating in the same area. We're at one conference table, huddled. Now we will spread out. So making sure all of that is laid out. And even though we're normally friendly, we have to stick to the reduced risk measures, because we want to make sure that we are practicing them safely in the office, and that will carry over into their homes. So that's the biggest win in terms of doing our part.
I feel like you guys got questions in advance or something, because I can't get to the questions that I want to ask. You're giving me so much good information, because I wanted to point out, some of us are in different industries. You mentioned construction, transportation, home health. There's a variety of industries that small and diverse businesses participate in. But ultimately, I think it's really important to know, no matter what you do, I sit in an office, and there is so much that I need to take into consideration in terms of reducing risk. So it doesn't matter what is being done, what kind of products or services are being provided. If your office is in your home, there are still so many precautions that need to be taken into consideration. And it's very important that everyone remembers that. Going back to what Kathleen started off with, it's about reducing risk, minimizing the risk as much as possible in order to prevent the continued spread of COVID. So thank you so much. Sharice, what has it been like for you with your team working from home? How has that impacted the daily operations? Has the team been able to continue? Has the business been able to continue?
So we've been very fortunate. As I mentioned, a lot of our clients have allowed us to conduct meetings remotely. But what the main thing I keep in mind is the stress of having to work from home, having to manage your family, making sure you're able to continue to work when a lot of people are being laid off. So I sometimes say, tomorrow let's take off, because you have to give people an opportunity just to decompress, because we are in a really stressful environment. I'm very flexible in terms of the hours, in terms of not checking in all the time, just allowing them to work and demonstrate their accountability by seeing from the project management tool that we use that everyone's on par with client projects, and also making sure I hear their feedback of what they would like to see when we return to the office, because many of our employees have children. So if we return to the office in June 1st, will that work for them? So I just want to be sensitive to them. I think that's the key part of being an employer, working remotely, not only just the work element, but the personal and human side, because there's a lot to consider during this process. So for me, the main thing is making sure the stress level is down. I'm supportive of them. And then on the flip side, for the media or promotional, making sure our clients understand social media wise, our hours, how to access us, that we're always available by cell, making sure we're still responding. If we responded within an hour when we were in the office, we respond within an hour, even if we're working remotely. So for me, my main thing with my staff was, let's not demonstrate any drop off. They should still feel the same level of service, even though we're working remotely. And I try to encourage them, get their input, let them know they're part of a solution as we all navigate this process. I know that's long-winded, but I think
no, what you're doing is you're focusing on exactly, I think, what we need to hone in on a little bit. There will be no pre-COVID. Life pre-COVID will no longer exist. We have to adapt to a new reality, especially, again, there's no vaccine, there's no identified treatment just yet. So there are a lot of things that we will need to take into consideration for the future. Derek, you said something really important earlier as well. With your future contracts, what are some of the ways that you can continue to reduce risk? You may be signing a new contract next month, and some of these practices now you need to incorporate into the contracts that you execute, or let your customers know these are going to be a part of your requirements. So I think we got to do a lot of forward thinking to make sure that we're reducing risk until this thing can be brought under control, or at least managed more consistently. Derek?
I just wanted to mention also, our company president, Mr. William Berry, he's a stickler for giving our clients not what they're paying for, but that and much more. And to give you an example of the way that Mr. Berry runs our business, we have a contract whereby we're to come in and to just disinfect, wipe down, and that's sufficient. Mr. Berry, out of an abundance of caution, decided that the facilities in which we were contractually obligated to do that service for required electrostatic disinfecting. As a result of his assessment of what was appropriate and what should be done, in spite of the client having an issue, in regards to finances, because everybody's pressed at this time, budgets are exploding, so on and so forth, he made sure that we had a team to provide that service at each one of these facilities free of cost. So I just wanted to make mention of that, because everybody is not out here trying to make a quick buck or, finagle somebody out of something. In fact, we're trying to give you what you're paying for and more. And I wanted to make sure that I stated that.
Thank you. And Jackson is a customer of Able Business, and I can attest to that.
I appreciate you.
Okay.
Awesome.
I just want to offer the panelists, if there's anything we didn't cover that you feel that people should know, please let me know. We're going to jump right into Q&A. Okay. So some of the questions that we received include, and this is from Corey McKnight, should employers recommend that employees be tested for COVID-19 antibodies before returning to work? Kathleen, what are your thoughts on that?
No. Testing is a really complex process, and it's very complicated, and it's just not straightforward when it comes to COVID-19. And there are various kind of testing platforms. One is PCR, where the test will identify the RNA of the virus if it exists, and that can be live RNA, indicating that the patient is infected currently, or it could be killed RNA, meaning that the patient was infected in the past and they're still carrying some of the dead viral particles. And
Kathleen, what is RNA? I'm sorry. I'm a layperson.
Perfect.
Ribonucleic acid. It's genetic material.
Okay.
And we are seeing patients in the hospital who have positive PCR tests looking at the genetic material of the virus for extended periods of times, 45 days, 60 days, and there's no way that they're still infectious. So testing, if you're symptomatic and you get tested, it will tell you if you have COVID-19 or you don't. And once again, there's always the potential that there could be a false positive, a false negative. Antibody testing, on the other hand, looks for evidence of either, well, mainly past infection. Has your body started creating antibodies to the virus? At one point, we believed that people had antibodies, just like with most respiratory viruses. If they have antibodies to the virus, then they're immune. They're not sure that that is truly the case, and it's possible that reinfection can happen. When the pandemic first began, I remember thinking to myself, I just want to get it, I'll be immune, I won't have to worry anymore. We don't know that that's the case anymore. So, but I would say if someone is symptomatic, yes, they should get tested so you know that the person is infected or not, and that would help with contact tracing and would help you to protect the rest of your employees and your staff.
I just want to jump in. Kathleen, thank you for saying that in regards to this whole immunity, that once you get the disease, that if you don't get sick, you're okay. Because that's actually something that's going around quite a bit now that we're having this reopening. And what scares me is that this is a very new disease. And we know very little about it. All the experts say we know very little about it. So we don't know about how it will transition from, if someone has it, can they pass it on to their child? If later on in life, if they have it, if they get high blood pressure or a heart disease, that puts them in a condition where they can actually have a higher mortality rate because they got COVID-19 and heart disease later on in life, or that they can get sick later on because they're healthy now and they have the disease and they asymptomatic. If they get sick or their immune systems come down later on, a year, 2 years down the line, how that may affect them even more. So thank you for her speaking on that, because that is a very important point to make.
Well, you're very welcome.
And I'm here in the Q&A, and I see that Kathleen has been very busy. So she is really serving two purposes here. She's giving information online, and she's actually answering questions in the Q&A. Thank you, Kathleen. That's really going above and beyond, and I for one appreciate it. Thank you. But for the benefit of the people online, is alcohol a good disinfectant? Matt mentioned that he got the 99% alcohol from Able Business at a time when he couldn't find it in the store. And I'm sure you can't find 99% alcohol in the store anyway. So can you tell us if alcohol is a good disinfectant?
Alcohol is not typically used as a disinfectant. It's a skin antiseptic. You use it to clean your skin before, blood draw, whatever. It is, it will kill the virus for sure. It will kill it on surfaces. The thing to be careful with when you're using alcohol, especially 99.9% alcohol, it is super flammable. You can't use it by fire, have no candles going while you're doing this, don't smoke. Make sure that it dries and it air dries. The disinfectant antiseptic activity happens as the alcohol dries. So you put it on the surface and wait for it to dry. And then you can light your fires, whatever. But it's a very dangerous liquid to use.
Okay. Thank you.
Actually, thank you for that, Kathleen, because I, in my personal household, one thing that I do, because we have groceries, we have fruits, we have all this, we got Amazon packages coming in. I literally would spray, and me and my family, I got a 7-month-old at home and two little ladies, so I got a family. I want to make sure it's protected. So we spray everything with alcohol outside and let it sit until it dries, and then bring it into the house. And for the packages that we can wipe with Lysol, we'll do that too. So thank you.
Pretty safe.
Sharice?
I have a question. So if an employee has symptoms, gets tested, is positive, should you require a negative test before they're allowed to return?
No.
Or is 14 days enough? Is that 14-day window that they talk about, is that enough? So that come back to the place, the work site?
That is typically enough. There are times when immunocompromised patients can shed live virus for an extended period of time. So somebody who's seriously immunocompromised, that's a different story. And we would need to look at that on a case-by-case basis. But the CDC is really going away from making decisions based on testing. Once a person is positive, at one point they were requiring 2 negative tests 24 hours apart in order to consider the person cured. Now, with the understanding that the test can stay positive for a long time beyond when the patient is actually infectious, the recommendation now is 10 days after diagnosis and then 3 days of being asymptomatic, no fever, no shortness of breath. When you've gotten there, so it's essentially 14 days, you can assume that the patient is no longer infectious and will not pose a risk to people that they come in contact with.
Thank you.
Thank you.
You're welcome.
Someone asked, what type of thermometer is best to use to check employees?
The no-touch version.
Derek, Disabled Business sell those thermometers. Yo.
It's ironic that you said that Mr. Beery has some on order.
Oh my goodness. See, I knew that.
Because we utilize the non-contact infrared thermometer for the forehead. Doctor adequately stated that. That's correct.
There you go. There you go. You guys are ahead of the game. Okay. Kathleen Kareen Gentle asked, is hand sanitizer really effective? And I think that is a great question. Everywhere I go, I jump in the car, I use the hand sanitizer, but I still, when I get home, I make sure to wash my hands with soap and water. So is hand sanitizer really effective? And what should our focus really be in that respect?
Hand sanitizer is very effective. It has to have, I think, 62% alcohol content in order for it to be considered a truly alcohol-based hand sanitizer. And yes, the virus is killed by alcohol. You should wash your hands with soap and water. If they're visibly contaminated, they feel sticky, you've touched somebody's blood or body fluids, you've wiped your nose, you've blown your kid's nose, whatever. Before you eat, you should use soap and water, but a lot of people use hand sanitizer, and that's better than not.
Thank you. Looking at the time, we are coming right up on 11 a.m. I'm very glad that we got a chance to answer all of the audience questions. I learned so much today, and I always, when we do an outreach event, I make sure to ask those in attendance to raise their hands if they learned something today. So I can raise my hand. Oh, look at Derek, everybody. We all learned something today. And I really think that this is really good information, not only for businesses, but the general public. I'm very glad that the Chamber has recorded this. This information will be accessible and available after today. So for those that did not get to participate, those that are online, please make sure to share this with your friends and families so that they can take some of this information and put it into practice because we're not safe. There's no vaccine, there's no treatment. Thank you, Kathleen, for that. You really have put things into perspective for me in terms of what we're facing. It's our jobs to minimize the risk to others, to ourselves and others. So thank you all for your participation. Thank you for making yourselves available. Thank you for getting on technology and making this such a successful event. There was no crazy background noise and people running back and forth. So thank you so much. You guys did a great job. Matt, I'm gonna let you go ahead and close us out.
All right, again, I want to again thank Jackson Health, our partners, on behalf of the Miami-Dade Chamber of Commerce, Ms. Lawhorn, as our small business. Please make sure you follow up with Amber Lawhorn. She is the best connect if you want to do business with the Jackson Health in terms of contracts, procurement, and all those things. So please make sure you connect with her. Special thanks to Kathleen for really just giving us that expert opinion. We hear so much from so many people through the news and the media. So to have someone from Jackson Health, who are as Miami-Dade experts in infectious diseases, to come out and join us to share that expert perspective. Thank you so much, Kathleen. And also to our members of the Miami-Dade Chamber of Commerce, Able Business Services and Creative Vision Media. Shout out to Able Business Services, Mr. William Berry and Derek Williams, for being a resource for our community, providing that janitorial services and cleaning supplies that is not running out anytime soon, because they make sure they stay stocked up. So make sure you check out Able Business Services off of 79th and 12th. We'll post the information, but you can easily look them up, Google them. And also our other media all-star member of the Chamber, Creative Vision, Sharice. Chester, thank you so much for joining us and really giving an understanding of how people really can get after these government contracts by having a safety plan. That is very important. So on behalf of the board for the Miami-Dade Chamber of Commerce, our chairwoman, Teresa Fox, and our president, Eric Knowles, just thank you very much for being here and being a part of this. As a Miami-Dade Chamber, we do offer services that you can take advantage of during this time of crisis. One of our major things that we offer right now is it's just a micro loan for small businesses. Due to COVID-19, we've actually cut the interest rate in half. And also we're doing deferrals based upon businesses. So please make sure you take full advantage of our microloan program that we have alongside our technical assistance. During this time at the Miami-Dade Chamber of Commerce, we are doing one-on-one consultations with business owners to help them understand how to navigate the contracting process, get your business legitimized so you can take advantage of capital that is out there, assist you with the process of the PPP loans. We actually have daily calls with our members every day at 4 p.m. If you follow the Miami-Dade Chamber of Commerce page, the Facebook page, you can get on and be a part of those daily calls. So please reach out, visit Miami-Dade Chamber of Commerce at m-dcc.org so that you can have the full services of what we do as a chamber to make sure we're coming together, building each other during this time where we need to be in this together as a business community. So thank you very much for all those involved. And I just want to give a special shout out to Jackson Health for this amazing partnership. And please make sure you sign up to their newsletter that they have that is sent out, and you can reach out to Amber Lawhorn to get on that newsletter. So we're going to close out right now. This is one of many that we will be doing over the next few months. So look out for more information by joining our chamber and Jackson Health newsletter. So with that said, for all my colleagues on the call, you can just wave everybody goodbye, and we're going to close out. All right. Take care.